March 3, 2020, the New York Times published this visualization. This marks the beginning of the COVID-19 pandemic in the United States. By that time, there were only a few cases in the US, and many states had not discovered their first case. The sizes of the red dots represent the number of cases, while the states with cases are marked as yellow. Soon after, coronavirus spread across the US, so the New York Times changed default map to a bubble map to tell the story. First, almost all the counties now have some cases. Second, there were clearly a few epidemic centers, such as New York City. Later in May 2020, the US people finally breathed a sigh of relief as the total number of cases fell that month. However, many southern states witnessed an increasing number of cases again after this drop due to the reopening order. To better review the trends and patterns, the New York Times changed their visualization again to a diverging choropleth map showing hotspots of how the number of new cases had changed in the last 2 weeks. The map classification fell into 4 categories: falling, about the same, rising, and fewer or no cases, telling both the good news and the looming threat of the second wave of COVID-19. Then the second wave came. On August 19, 2020, the New York Times provided a newer version of their visualization. As case numbers rose in almost every county, the New York Times removed the falling class and reclassified it with an 8-level sequential color scheme. This change alerts viewers that the second wave has become the main theme. Like the maps created by the New York Times, many COVID-19 visualizations have changed over time. We refer to this type of visualization changes as crisis-driven changes, which reflect the dynamic nature of the crisis as well as an urgent need to adapt existing visualizations to better suit the constantly changing crisis situations. Visualizations are mostly evaluated as a one-time thing in research. We often hope one visualization can solve the problem of the domain. However, the pandemic and other crises pose new challenges to the existing evaluation approaches. Essentially, a crisis is characterized by its intense and broad impact, high risk, urgency, fast-evolving nature, and high level of uncertainty. Therefore, under a crisis, can we still ignore the constantly changing factors when seeing and evaluating these visualizations? We argue that we need more research and new methodologies that examine the visualizations in situ and in the wild. Another type of visualization change is public-driven changes. The Georgia Department of Public Health released a graph on May 17, 2020, showing COVID-19 cases had supposedly fallen among 5 Georgia counties. But notice that the dates on the chart were out of order. Many social media users critiqued this misleading visualization and pointed out their mistakes. The graph has been taken off the website since then and been updated. This example shows how public participation and the critiques of misleading visualizations can be powerful ways of bringing immediate and effective changes to visualization designs. People are increasingly engaged with visualization design in times of crisis using social media. They participated in detecting, criticizing, co-designing, and redesigning existing visualizations. Their collective critiques and the redesign of these crisis visualizations contribute a collective memory that may shape the form of the culture in visualization design and evaluation. People are changing culture as they participate. In this paper, we also examined other aspects of COVID-19 crisis visualizations, guided by our proposed framework, focused on who uses what data to communicate what message, in what form, to whom, with what effect, and under what circumstances. Our framework captures dimensions of crisis visualization design space and important areas that warrant further inquiry.